Digital ICT and simulation isn't just used for online shopping and video games. I have procured a thorough case study on how South Korea managed to flatten its COVID-19 curve using ICT. Experts have called COVID the gravest war since World War II, and South Korea has been no exception to the pandemic either. However, the daily active cases in South Korea have been declining since March 15th, and the daily new cases since March 11th. This is according to worldometers.info as of April 25th, 2020. The nation has been overt in highlighting that it managed to do this without enforcing draconian measures. ICT plays a key role in the war against COVID in South Korea. Mobile devices are used to bolster early testing and contact tracing. Advanced ICTS plays a key role in the transmission of emergency information. ICTS also assists in social distancing. National and local government websites shared pertinent information on COVID-19, like testing results and latest information. They even provide real-time information on where free masks are available for collection. The government promotes free smartphone apps that flag infection hotspots with text alerts. ICT helps social distancing. Cellular Broadcast Service, or GPS, allows government agencies to send emergency alert messages to cell phones. They can send these messages without a delivery bottleneck since it doesn't use the general SMS text messaging system. Municipalities throughout Korea use CBS to inform the public of the movement paths taken by confirmed patients. Residents can quickly check if they have been anywhere that overlaps with the movement of a confirmed patient, allowing them to get tested quickly if necessary. Smart working. Korea developed a special website providing info of solution companies for remote working. These websites provide information about companies providing solutions for remote working and education. They also host virtual video conferences within municipalities to encourage smart working and social distancing. An example of this is disaster safety response meetings, which are held via video conference call. Remote working for the government sector is also promoted to the use of a global virtual private network, GVPN. The government put stricter guidelines for work in place that mandate public officials to shift to remote work using Korea's ICT infrastructure. Civil servants use GVPN and G Drive when working remotely. This is a system through which employees can log onto the government ministry's intranet even outside of the office. G Drive is a cloud storage system tailored to public officials working for central admin agencies, which allows for the storage and managing of work materials in the same format as those saved in office computers. The number of GVPN subscribers stood at more than 87,000 on April 1st, 2020, more than 4 times from the figure at the end of last year. Evoke predicts that this will definitely increase widespread adoption of flexible work environments, not just in Korea, but in other examples around the world. Cybersecurity guidelines for staff working remotely were developed, including making sure staff should use VPN, automatically log out idle users, refrain from visiting websites unnecessary for work, etc. Remote Education Initiative was launched, providing educational content by the central government since all schools are shut down. The Korean government offers science content online to minimize interruptions in students' learning. Science All is a science portal website which aims to introduce diverse online science content and contains immersive content for learning science, such as AR, VR, and comics and quizzes. There were 30,000 average daily users as of the 4th week of March, according to a report submitted by the Korean government. For extremely difficult classes, the government created hands-on learning content using simulation software for 23 high-demand classes, such as quantum chemistry. This simulation platform is called Edison. Here, students can get hands-on experience through simulation and access diverse content, including videos, text, and data. There are no data charges for students, parents, and teachers accessing the EBS website. Major TV companies also provide real-time EBS educational content, such as lectures. Additionally, 36,000 smart tablets were donated to children in low-income families. A remote Medicare initiative was launched, temporarily permitting doctors to perform telemedicine as of the end of February. This avoids group contagion and entails patients to receive phone consultations and have medication prescribed without visiting medical institutions when doctors deem it safe. Telemedicine services were implemented in the Seoul National University Hospital as there were clusters of confirmed coronavirus patients in the Daegu city. The hospital relies on video calls and electronic systems more safely and efficiently to monitor coronavirus patients hospitalized with mild symptoms. Here, nurses ask patients detailed questions about their conditions via video calls through smartphones. The hospital has been able to check symptoms of confirmed patients in real time and transfer patients with aggravated symptoms to larger neighboring hospitals. Additionally, telemedicine apps like MetaHere allow for patients to select which hospital they want to visit and make an appointment to see the doctor. The app provides remote medical advice via video call using the telemedicine treatment room. Prescriptions are then sent to the pharmacy designated by the patient. The Coronavirus 119 app gives patients access to general diagnoses for a cough or cold alongside remote treatment and prescriptions for suspected coronavirus symptoms. If an app user is suspected of being infected with COVID-19, they're connected to the 1339 hotline. There they can receive a diagnosis and receive a prescription from a doctor by phone after filling out a questionnaire that screens for symptoms. Predictive research on the spread of COVID-19. The government is supporting predictive research on the spread of COVID-19 carried out by Korean researchers using diverse methods by identifying and sharing data that can be used by researchers within the scope of data protection and also by helping researchers establish a professional network among them. This is useful for forecasting the macroscopic spread of COVID-19. Korea has also developed a number of apps related to COVID. This is very impressive. Now and Here calculates a mix of risk factors in surrounding areas when users enter the commuting routes. This calculates your route against the path of those previously taken by the confirmed COVID-19 patients. Kobik alerts for coronavirus within 100 meters. A number of startups and private developers have also aided in this process. Lee Jun-yong, the developer of CoronaMap, said he made the app because he found the government data difficult to understand. Although health officials release locations that show where coronavirus have been, the official information isn't very useful. So Lee decided to put together that information in a map. CoronaMap was the second most downloaded mobile app on Google's app marketplace this week. As the name suggests, the app maps the exact locations where each confirmed patient has visited using different colors. However, while these apps are free to download, developers of Corona 100M and Corona Map said they're putting in money from their own pockets to run the apps but are asking for donations from users. When I think that this app can prevent the spread of coronavirus patients by advising people not to go to certain places, I feel proud, said Lee. The Corona Map developer said, before adding that he hopes the government builds one of his own app to develop one on his own. ICT also locates COVID-19 with speedy tests, a diagnostic kit developed by a Korean company using ICT, AI, and supercomputers. CGene uses high-performance computing and AI algorithms to dramatically shorten the process of testing, from developing a virus diagnostic kit from several months of expert dedication to around 2 weeks. CGene's product is a real-time reverse transcription polymerase chain reaction test kit for detecting the COVID-19 virus. It detects 3 different target genes in a single tube, which allows highly accurate results and effective mass testing. As of April 28th, CGene exported over 10 million COVID-19 diagnostic tests to over 60 countries. As of April 22nd, they've obtained an approval from the FDA as well. Additionally, AI-based medical image specialists train their AI algos with large-scale chest X-ray photographic data to detect abnormal findings. Findings include pneumonia, which is a major symptom of COVID-19 patient, with a high accuracy in a few seconds. Vuno, for example, installed an AI that can ready X-ray imaging of patients with lung conditions and identify those requiring intensive care in just 3 seconds in a public health clinic in Hongshan. AI for medical imaging analyses processed on a small device is attached and connected to portable X-ray equipment in COVID screening centers and ambulances. This analyzes lung images of severe cases with lung diseases, reporting the results shortly to healthcare professionals to help them with diagnoses. In some regions, not enough healthcare workers or hospital beds exist, So it's critical to quickly screen patients and firstly accommodate patients with severe symptoms. I hope this has shed some light on how AI, digital, big data, and ICT has helped a country fight against a life-threatening pandemic that has affected all our lives. To conclude, I'd like to say a heartfelt thank you to healthcare workers and public workers globally, as well as all the leaders who have acted against COVID-19. Stay tuned for the second part of this case study, and please see the link for the written version of this case study with references provided as well.